Item 6 today is the Welsh Conservatives debate on cancer services. And I call on James Evans to move the motion.
Diolch, Deputy Presiding Officer, and I move the motion tabled in the name of my colleague Paul Davies. Cancer doesn't wait, and neither should we. Yet for far too long, Wales has failed to deliver timely, life-saving cancer care that our constituents expect and deserve. The Audit Wales report laid bare the truth. The 62-day target for treatment has not been met, not once. Despite a 54% increase in spending on cancer services since 2009, failures remain. Workforce shortages, outdated diagnostic equipment and chaotic leadership have created a postcode lottery of care. This is simply not good enough. The Welsh Government's written statement today, whilst acknowledging these issues, fails to address the scale of the crisis. It speaks of progress, but stabilising a system at failure is no success. Let me be clear. Cardiff and the Vale achieving 70% of patients treated within 62 days in October is better, but the national target of 75% remains unmet. Other health boards lag far behind, with inconsistent performance creating deep inequalities in cancer care. Workforce shortages are crippling. Wales is lacking clinical oncologists, dermatologists, pathologists and key surgical specialists. Our diagnostic capacity is similarly inadequate. With outdated equipment, prone to breakdowns, this is a fundamental failure of planning and leadership. Meanwhile, the Welsh Labour Government's Cancer Improvement Plan is poorly coordinated and lacks funding. Even NHS leaders from across Wales admit confusion about how it interacts with other initiatives. This mismuddled approach is letting patients down. The Audit Wales report makes 10 clear recommendations, and they must be implemented in full. But that is just the start. Here's what the Welsh Conservatives would implement to fix cancer care and fix our NHS. We would have a long-term cancer strategy. The current 3-year cancer improvement plan is a sticking plaster, not a solution. We need long-term cancer strategies that consolidate initiatives, provide clear governance and ensure accountability. Evidence from other countries show that long-term planning delivers better outcomes for patients. We would have immediate action on workforce and equipment. The NHS cannot deliver timely care without the right people and tools. Recruitment in critical care areas must be prioritised alongside investment in new diagnostic equipment. We cannot expect patients to wait because machines are broken or are simply not enough staff to treat them. We would implement targeted lung cancer screening. Lung cancer is Wales' biggest killer, and 72% of patients that are diagnosed are at a late stage of treatment, and their options for life expectancy are limited. So we would implement that targeted lung cancer screening across Wales to make sure our worst cancer and our less survivable cancer gets sorted. We would put a strong priority on prevention efforts. 4 in 10 cancers are preventable, yet the government's prevention efforts here are far too limited. Tackling smoking, obesity and other risk factors will ease the burden on cancer services tomorrow. We need bold, focused public health initiatives to save lives. And we will have a clear leadership and accountability. While the establishment of a National Cancer Leadership Board is welcome, it must deliver tangible results. Patients and staff are tired of empty promises and endless summits. Leadership must mean action and accountability when targets are missed. A Welsh Conservative government would make boards directly accountable to the ministers and CEO of health boards to increase oversight and ministerial accountability. The Audit Wales reports highlights Wales' poor performance compared to other nations. For less survivable cancers like pancreatic and lung cancers I've mentioned, we are near the bottom of international rankings. This is unacceptable for a nation like Wales. Our constituents deserve better, and it is our duty to make sure we get it right. And I give my promise to the people of Wales. If I am Cabinet Secretary for Health and Social Care after the next election, there will be no more excuses and no more empty promises. I will tell you, I will turn it around. The Welsh Government's written statement today outlined some positive steps, but the pace of change is far too slow. Setting up meetings, producing reports and establishing boards will not save lives unless they deliver real results. The Cabinet Secretary claims progress, but let's be clear. We're still far, far away from meeting the basic standards of care that people expect. And as I have said, stabilising at failure is not progress. Cancer services remain fragmented and unequal, with some patients in certain parts of Wales receiving far worse care than others. That cannot continue. Cancer doesn't wait. It doesn't wait for the next board meeting, or the next report, or the next political promise. It is relentless. And our response must be just as urgent. I can say that prioritising cancer care will be a top priority from the Welsh Conservative Government after the next election from day one. We need a government that prioritises patients and delivers timely care, not excuses, and a government that holds itself accountable to the people it serves and does not hide bureaucratic structures created by the NHS. Colleagues, we owe it to the patients waiting anxiously for a diagnosis. We owe it to the families praying for better outcomes. And we owe it to the NHS staff working tirelessly despite being let down by poor leadership and a Welsh Labour government out of ideas and on its way out of office. Let's demand more today, not just for the people of Wales, but for every person whose life could be saved by better cancer care. Cancer doesn't wait, nor should we, and I give my commitment and promise to the Welsh people that on this side of the chamber, we have a plan to fix cancer care, we have a plan to fix our NHS, and we have a plan to fix Wales. The time for change is coming, and it cannot come soon enough.